Hello, all of you. Thank you for watching me. I am happy to be here and share with you my expertise. So I would like to say thank you for the invitation and congratulations to the organization of this meeting. And my name is Mara Lofrano Prado. And today we will discuss about behavioral intervention and mental health in adolescents with obesity. I am currently a professor at California State University, San Bernardino, at Department of Kinesiology and also Department of Psychology. So let's start here. And I would like to start this presentation with a question. And what is health? We can have a lot of answers for this question because we have many definitions of health, okay? So the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. But this definition has a lot of critics. Once it is not possible to achieve a complete physical, mental, and social well-being. So here you can see we have a lot of definitions of health. We can look from different perspectives. So health is achievement of a common standard and also is achievement of an ideal outcome, can be a experiential, and also health is the ability to function and participate, can be defined by determinants, and also health is an individual and population phenomenon. Also, health is a multidimensional phenomenon, can be defined by control people have over their lives, and also health has to be sustainable. So from my perspective, we have not only one answer for this question, what is health? We have different approaches and different perspectives to look at health. There is no right or wrong answer. And health is influenced by many factors. As you can see here, we have a lot of factors can influence health. And the context of people's life determine their health. So if you look here, childhood experience can impact health. If the experience of violence, abuse, or neglect can be linked with poor health. And also here we have social support. So greater support from families, from friends, and communities is linked to better health. And also here we have communities, housing, so physical environment, if you have safe water and clean air, healthy workplace, safe house, and communities, this can contribute to a good health. And as you can see here, employment. So people in employment are healthier. And education, here, if you see low education levels, can link it with poor health, with more stress, and also with lower self-confidence. And also family income can influence health, higher income, and social status can be linked with better health. And access to the services, access to health services also can be influence health. So here we have two different ways to look at health. We can look from this way here. We have many aspects influencing our health, and also we have our lifestyle influencing our health. We have here in lifestyle, this can include eating behavior, exercise, or sedentarism, and also sleep hours, stress management. And so we can look to health in different perspectives. Okay, we can look in one way, this way influencing our health, and also our lifestyle influencing our health. So childhood is a good time for learning health practice and develop a healthy lifestyle. We should be aware that adolescence is also time of vulnerability, but also time of opportunity. Okay, so adolescence is a time that young people can be exposed to bad habits like smoking, alcohol, drugs, but at the same time, this period is a time of a window of opportunity to learn good and healthy habits. It's important to note that adolescents who engage in health habits, they can decrease the risk to develop chronic diseases in their adult life. And this is very important. So adolescence includes some big changes to the body and to the way a person relates to the world. And it's a period with many physical, sexual, cognitive, social, and emotional change. So adolescence is often considered the healthiest time in a woman's life. This dominant view of adolescent health may be the main reason why adolescents have attracted low interest and investment in health. As you can see here and here, currently only 1.2% of a global health research is conducted with this population, with adolescents. So as I said before, adolescence is a time when people can modify or alter the paths of their health with reflection in their adult life. So if you see here, obesity can impact adolescent health in two different ways. We have here impacting physical, okay? This part is adolescent can increase the risk to develop chronic diseases. And also obesity can impact the emotional health, so can increase the risk to develop anxiety, to develop depression, and also it is related with helplessness, and also self-consciousness, social isolation, stigma, insomnia, negative self-worth, and also lack of motivation. So obesity in adolescents have psychosocial effects like discrimination, social isolation, and social exclusion. And also there are a lot of adolescents with suicidal thoughts, okay? And obesity in adolescents also it's related to emotional distress, can impact uh, in a negative way self-perception, self-image, can decrease self-esteem and increase depression, anxiety, and also eating disorders. So these psychological problems can affect adolescents' quality of life and well-being, as you can see here. And behavioral intervention is a good way, I can say, is the best way to help this population, to help adolescents changing their habits and their behavioral, and can improve their quality of life. So manage and decrease depression, anxiety, eating disorders, stress, shape concerns, and also improve self-esteem is a good thing. Behavioral change, behavioral intervention can do for adolescents. So once obesity in childhood and adolescence tends to remain in adulthood, and considering the adolescence is, as I said before, a good time for interventions based on behavior change, it's important to develop effective interventions for treating obesity, not only focus in decrease body fat, but also focus in improve adolescents' quality of life with sustainability of the outcomes in a long term. So here you can see we have three different approaches to three different treatments, types of intervention for treating adolescents with obesity. We have behavior intervention, and this can have different approaches and targets, and can include psychological and nutritional counseling and exercise as well. And also can add many components like group sections and individual sections, sections with parents together with the adolescents, or only with the adolescents between others. And also we have a treatment based on medication, and the other treatment is surgery for patients with severe obesity. And here we know nowadays that behavioral intervention with at least 26 hours of contact time, and including psychological counseling, nutritional counseling, exercise, and are the best option in the obesity treatment, because can positively modulate many aspects of health in adolescents with obesity. And we can look here. This is a intervention we have did in Brazil. So as I told you, behavioral intervention can use different approaches. In this one, we have used two different kinds of different types of intervention. So one intervention have included psychological counseling and also nutritional counseling. And the other one, the other group, we have used the same counseling, psychological counseling and nutritional counseling, and we add physical activity. So we have had two groups with adolescents, and we have followed them for 12 weeks. And we have observed that when we incorporated physical activity in the behavioral intervention, it was a great strategy to reduce the dropout rates in our intervention in the obesity treatment for adolescents. So we can look for exercise and physical activity in two different ways. As I have showed you in our intervention, exercise was a motivator for engaged adolescents in the intervention. But in other way, behavioral intervention can help adolescents change their habits and reduce time in sedentary behavior. Today, this is one main goal: reduce sedentary behavior and engage adolescents in physical activity. So it is important to find a motivation for exercise in this population, and we can have different motivations. Also, we can call exercise medicine because can prevent death from chronic disease. So it's a good thing to incorporate in behavioral interventions. And also, behavioral intervention can help adolescents to improve eating habits. So eating habits, it's more than improve the quality of food they are eating, but can help this population, help adolescents establish goals and monitoring the way they are eating. They can control if they are eating without hungry, or they are emotional eating, for example. So behavioral intervention, again, including psychological counseling, nutritional counseling, and also exercise, is the gold standard in the obesity treatment because can help adolescents change their lifestyle and improve their well-being and quality of life. And the most important thing is adolescents who engage in healthy habits can decrease the risk to develop chronic disease and live longer. So it's very nice. So this is what I want to share with you. I hope you like it. And if you have any questions, if you can discuss anything, just email me and I will be more than happy to discuss this field with you. Okay? Bye-bye. Thank you again.